this is Lindsay Sullivan back at Bone and Joint Institute for our monthly Facebook Live series. And today I have Dr. Richard Gibson with us because today is May 31st and it's also the last day of Osteoporosis Month and Bone Health Month. So we just wanted to get together as we kind of wrap up the month and talk about bone health. So Dr. Gibson, before we get started, tell me a little bit about yourself and your specialty.
Yeah, so I joined the practice in September, just out of fellowship. I'm originally from Maryville, Tennessee, and happy to have made my way back to Tennessee here. Was last in Birmingham doing a fellowship in primary care sports medicine. So I basically do all non-operative orthopedics. Happy to take care of any and every body part and help get you treated. And then if we do end up having to need surgery, then we'll get you to the right person. But I kind of do a lot of different things here. Take care of a lot of the concussions for our high school athletes.
Through Williamson County Schools, yeah?
Awesome.
Well, thank you again for giving us your time today at lunch. So, like I said, it's the end of Osteoporosis Month. So I kind of want to talk about what is osteoporosis and what's the important, who does it affect, what's the importance of bone health. So let's start with what is it?
Osteoporosis is decreased bone density. So it's often confused with osteoarthritis, which is more wear and tear to the cartilage in your joint. If you have osteoporosis, it means that your bones are more brittle and more likely to break. So that usually affects most commonly women, postmenopausal women over the age of 50, but it can affect men as well. 1 in 2 women will have an osteoporotic fracture at some point in their life over the age of 50, and 1 in 4 men will.
Wow, that's quite the statistic.
Yeah.
What can cause it?
It's usually a hormonal issue, postmenopausal, and it just is something that our bodies is always kind of naturally losing bone over time.
Okay.
And so just over time, our bones are getting weaker as we age.
Okay. And what types of injuries, in your practice, what types of injuries do you see, or what brings a patient in that you would have an osteoporosis conversation with?
Yeah. The 2 fractures that are most commonly associated with osteoporosis are vertebral compression fractures in your back or a hip fracture. But oftentimes the ones that we see the most often are wrist fractures or just low energy trauma fractures to the ankle or the foot. Those can often be the first signs that you have osteoporosis, because otherwise it's a silent disease. You don't have any symptoms until you break something.
And how do you find out that someone does have osteoporosis?
There's a screening test for it. So we'll typically send you over to the hospital to have a bone density test done that looks at your back and your hips to see if they are more likely to fracture.
Okay, and so once that diagnosis has been made of osteoporosis, how is it treated? What different options? Can you take something? Is it an injection? Is it surgery? How do you help that?
There's several different options for it. So first you want to make sure that you have good calcium and vitamin D levels before you start any treatment for osteoporosis. You want to correct that deficiency if it's there first. And then there are several different types of medicines that can help. There are pills that you take daily or weekly. There are injections that you do once a month or twice a year. There's even an IV infusion once a year option. Most of the traditional medicines for osteoporosis are aimed at decreasing that bone loss that we naturally have over time. But there are some newer medicines that actually help build new bone.
Really? Okay. Well, awesome. And now, so we know that someone has the diagnosis of, but let's take a step back. How do you prevent osteoporosis, or is it even preventable?
There are some things you can do to decrease that risk. Certainly avoiding tobacco and alcohol, having a good healthy diet, making sure your calcium and vitamin D are normal, and getting regular weight-bearing exercise are important for the prevention, but it may not fully prevent the development because it's a natural thing that happens as we age.
And how does, we know it's important to try to prevent it, but like you said, it can't always be prevented, but how does overall health and wellness, how is it affected by osteoporosis, or at least trying to prevent it?
Yeah, hip fractures, back fractures, those can be really debilitating things. And so it's one of the biggest risk factors for our elderly patients needing to be in long-term care, nursing homes, that kind of thing. Can lead to decreased mobility. You may not be able to get around as well. So if there's a way to prevent future fractures, it's something that needs to be done.
Absolutely, absolutely. Well, again, thank you for your time, and hopefully everyone was able to learn something about osteoporosis and just the importance of it in general, but also the prevention piece. And Dr. Gibson, one thing we kind of close every Facebook Live with is just kind of describing the comprehensive care that we're able to offer here at Bone and Joint Institute. So can you talk a little bit about that and how your practice is kind of adds to the comprehensiveness?
Yeah, I see it a lot in my practice. I think it's the teamwork that we have here. Because I'm non-surgical sports medicine, I do a lot of our ultrasound guided procedures and that kind of thing. So oftentimes one of the surgeons will call me and ask me to inject something, and then we'll get them over to another specialist to get that taken care of. Or if you come in and see me and it turns out that what you have needs surgery, then I'll walk you over to one of the surgeon's offices and get you in there too.
Okay, and so in everything in one building, in there from pretty much start to finish. So, well, Dr. Gibson, again, thank you for your time today. I really appreciate it. And if you have any questions or want to schedule an appointment, you can give us a call at 615-791-2630 or check out our website at www.boneandjointtn.org. Dr. Gibson, again, thank you, and we appreciate it. Have a great day.